Hello everyone, thank you for checking out today's video. This video is going to be a continuation of our series where we cover some of the benefits and pay that you receive while serving in the Air Force Reserve. Now in the previous video, I covered the steps on how to join the Air Force Reserve, so if that's something you're interested in doing, please check the description where I walk you guys through all the steps that it takes in order to enlist in the Air Force Reserve. All right, in this video, I will be covering something that I found to be very interesting and a great benefit to being in the Air Force Reserve, and that is your healthcare benefits. Now, prior to joining, I was self-employed, and I was paying upwards of $300+ a month for health insurance just for myself. So it was extremely expensive. And when I learned that the Air Force Reserve had its own healthcare that was significantly cheaper, that was one of the main reasons I was anxious to get in, because it saved me a lot of money. Now, if you are not on status in the Air Force Reserves, that means you're not on orders, you're not in basic, you're not in tech school, you're on orders less than 30 days, you are eligible for Tricare Reserve Select. Now, I will cover this in the, I'll put the link to this in the description, but this is from myairforcebenefits.us.af.mil. And this site just covers some of your Air Force benefits as it suggests. And this one right here, we'll jump around a bit, but this covers the overview of Tricare Reserve Select and how it works. So when you enlist in Tricare Reserve Select, I believe you have to pay up front 2 or 3 months of premiums, your monthly premium, to enroll in the healthcare program. So as we scroll through here, you can see the member-only coverage is $51.95 per month. This will change year to year. And then for you and your family, so that could be your wife and your kids, just you and your kids, you and your wife. So it doesn't matter for this one. This is just going to be what you cover. So even if it's 2 of you or 4 of you or 5 of you, this is the amount that you're going to have to pay for you and your dependents. And you have to make sure that you register your dependents. Otherwise, they will not be covered. So this is a great healthcare option for those of you that are interested. Maybe you don't get it through your civilian care, or maybe this is better than your civilian care, or maybe you want to supplement your civilian care with this healthcare plan. It's a great option for you. Now, this does not cover dental. Now, dental is separate. So let's go ahead and cover, in case those of you that are interested, you do get an eye exam with your Tricare Reserve Select plan. So you may qualify for a line of duty care. And where was it? I was just looking at it. There we go. With Tricare Reserve Select, you and your family qualify for 1 routine eye exam per year. So just keep that in mind. And then for your dental is separate. So you have to enroll in this separately. And here is the cost for those. So for active duty, so if you're an active duty member and you want to go ahead and pay for dental, it's $12.36 per month for yourself, and then $32.13 for you and your family. Now, just keep in mind, while you are serving in the Air Force Reserve, you may go on and off orders longer than 30 days. Now, if you go on orders longer than 30 days, you will qualify for Tricare Prime, and that is free. You will not pay for you will not pay for that. You may have deductibles when you go to see the doctor, but your monthly premium will be $0 for you and your dependents, and that will automatically kick in if you go on orders longer than 30 days. It doesn't immediately go into effect, so you may want to reach out to Tricare to see your effective date, because if you go on orders, say on like September 14th, it may not be active till like that following Monday or maybe a week from then. So just keep that in mind. So Tricare is going to be a great resource for that, so that you know exactly when your healthcare is active. And when you go off Tricare Prime, you have to re-enroll in Tricare Reserve Select, and that's where you have to pay the multiple months of the monthly premium again. So just keep that in mind, because if you're paying for you and your family, you may have to pay, what was the price that we were seeing? Like $500, because you have to pay those 2 months up front. It's either 2 or 3 months. I don't remember, but I'm sure it says it somewhere on here. But again, I will put links to everything in the description. Now, this right here just covers some of your co-payments and cost shares with the Tricare Reserve Select. So this just gives you an idea of what to expect when you go to see the doctor. So your deductible, again, these are the monthly fees. And then your deductibles. So E1 through E4, $62 individual, $125 for family. $188 individual, $377 for family for E5 and above. Prescription costs also apply to your annual deductible. Catastrophic cap, $1256. You see your outpatient care. Just keep in mind you want to make sure that you're going to an in-network doctor, otherwise you're going to have to pay a lot of money. And this is great. I mean, this is cheaper than what I pay for my civilian care. I don't use Tricare Reserve Select anymore. I just use my civilian one, but when I had it, it was fantastic. Look at that. Urgent care, only $25. Emergency services, only $50. Mine is $500 if I go to the emergency room. So this is good, guys. This is really good insurance. Laboratory and X-ray, $0. Ambulance is $18 in network for ambulance. Now, if you don't have insurance, that is going to run you upwards of $5,000, if not more. Keep that in mind. Outpatient air, 20% network or out of network. So if you have to get flown, it's going to be pricey, guys. So hopefully you don't have to get airlifted out anywhere. Inpatient, 20%. I'm not going to read off every single one of these. Health care or mental health, inpatient, 75. I'll just slowly scroll through these so you guys have an idea how much it is. Those of you that are going to be having babies, you can see. Not that bad, right? Not bad at all. Pharmacy. Yeah, I never used the military pharmacy. I probably should. It's a lot cheaper. All right, so that pretty much covers that. And there is Tricare East and West and overseas, so just keep that in mind. And yeah, you guys should be able to enroll through MilConnect. So that's where you should be able to set up your Tricare Reserve Select plan after you are officially enrolled in the military or enlisted in the military. You can also call them, so it might be easier to call them and they can help you out. But just wanted to share with you guys that this is a wonderful benefit when you're in the Air Force Reserve. While you're in, you might as well take advantage of all these different benefits. So you have, I made another video with the benefits of the Air Force Reserve, just kind of a brief overview. And I talk about, they have matching with their thrift savings plan. So I talk about the matching in there. So where they'll match the amount of money that you, I think it's up to 5% of the amount that you put in with your thrift savings plan after a period of time. And that's free money, guys. That is free money. That's like the Air Force's version of the 401k. So you probably want to do that while you're in. So that way, when you do get out, you have a nice little chunk of change that you can either roll over into a civilian 401k or a deferred comp if you work in the public sector. So it's another nice little perk. But I think we covered pretty much everything on here. And again, I will put links to all these premium pages and FAQs and all that good stuff in the description so you guys can check it out in your own time. Okay, everyone. If you enjoyed this video, please consider giving it a like. Please also consider subscribing to the channel. If you have any general questions, I'll do my best to answer, but more than likely, I will refer you over to Tricare because they will be able to better answer these questions for you. Catch you all in the next video very soon.